An anterior pelvic tilt is caused by an imbalance between the muscles responsible for anterior rotation at the pelvis and the posterior rotators of the pelvis. Those anterior rotators are going to be the hip flexors, the psoas right here, the iliacus right here, and the rectus femoris right here. When these muscles are tight, from, for example, sitting for too long, if you have a desk job, or if they're just active at the time, they're going to pull that pelvis into an anterior rotation. That's going to look like this, where the pelvis is pulled anteriorly, and it is also going to pull the back into an excessive arch. So if we look at the lower back, when that anterior pelvic tilt occurs, the lumbar spine area is going to have more of an arch than normal. The muscles responsible for balancing this out are going to be the abdominal muscles and the hip extensors. The abdominal muscles from superficial to deep include the external oblique, the internal oblique, the rectus abdominis, and lastly the transverse abdominis. When these muscles contract, they're going to compress the abdominal cavity, and this is going to result in pulling that pelvis posteriorly into a neutral position, which will also protect the spine during any type of lifting or exercise movements. The other muscles responsible for posteriorly rotating the pelvis are the hip extensors. The main one, as far as the pelvis rotation is concerned, is going to be the glute max, but you'll also have contributions to that posterior rotation from the hamstrings, the biceps femoris, the semitendinous, and also the semimembranous. When these muscles contract, they will do the exact opposite and pull the pelvis posteriorly, flattening out that excessive arch that was talked about originally.